Hi, today I'm just going to talk a little bit about pelvic girdle pain in the pregnant population, and I'd like to show you just a few exercises that you might like to try at home if you are experiencing this type of pain. Our pelvic girdle pain is something that's quite a common feature in pregnancy. It can affect the front joint of the pelvis, so the pubic symphysis joint, or the back joints of the pelvis, the sacroiliac joints, or if you're unlucky, it can affect all three of those joints. Typically, women that experience pelvic girdle pain would find that it is triggered by times when they change the distribution of their weight so that it's spread unevenly. So things like striding out when they're walking, going up and down stairs, might be when they go to stand on one leg to slip their undies on. And also times like when they've been lying on one side and then they go to change the side that they're sleeping on and they'll feel that trigger in their pelvis. I remember with my third pregnancy feeling that pelvic girdle pain right at the front, the pubic symphysis joint, and remembering that it felt like one of my kids had come along and given me a good sort of kick or punch into the groin. Like many symptoms, side effects of being pregnant, pelvic girdle pain, although it's very bothersome for some people in pregnancy, it's just another change that our body's making in preparation to welcome your baby into the world, and that in most cases it does disappear fairly quickly after you've birthed. So I guess hang in there. I often get asked whether our pregnancy Pilates classes are suitable for ladies to attend who have this type of pain or discomfort. And in 90% of cases, the answer is absolutely. I'm a real fan of trying to keep pregnant women as mobile as they're able throughout their pregnancy. And in fact, a lot of physios or midwives or doctors will refer ladies for us for assistance with the management of pelvic girdle pain. In many instances, we like ladies to go and have some individual treatment as well. So that might be some hands-on treatment through their pelvis. And it might also be beneficial for them to purchase some pregnancy support tights or perhaps one of the braces that can go on to provide some sort of external support. So it is important that if you are coming to classes or planning on coming to classes and you're experiencing this type of pain at the front or back of your pelvis, that you always make us aware in a class setting, because it usually requires modification of the exercise program that we're teaching in the class. So I've put together about 10 minutes of just some of the exercises that you might like to have a go at home, or just to show you how we go about making modifications in a class setting. Now, pelvic girdle pain, like many types of aches and pains that we get, varies enormously in its intensity between clients, and also in the one client it can vary dependent on the day. So some of these exercises would be suitable for you to do the whole lot, and in some ladies they might be only able to do a selection of the exercises. So certainly if you were finding that one of the exercises that you try sort of provokes some of that discomfort that you've been experiencing, then I'd ask you to leave it out and check with us at class, or maybe we just need to leave that one out altogether. I have had ladies come with quite severe pelvic girdle pain to classes, to the point where we're not even actually able to get them down on the floor. Everything that we need to do with them in class has to be up on one of the fit balls or supported at a bench or wall. So take a look through the exercises. I hope you find them beneficial, and yeah, let us know what you think. The first exercise that we're doing here are some double-sided knee openings or hip openings with some light TheraBand resistance. So you're making sure that you're pressing out evenly with both legs through the hips, so it's a nice symmetrical loading to work through the buttock muscles. This exercise is a supported clam exercise. So lying on our side, making sure that we try and keep our hips nice and level, stacked on top of each other, and we have a chi ball placed to support the weight of the top leg and hold the top leg with the knee in line with the hip. When you're performing your clam, you're taking some of the weight gently out of the top knee, opening it up, but keeping some support or some contact with the chi at all times. Just be careful that you don't roll your pelvis back as you're raising the knee up and down, keeping your feet together. This exercise is a kneeling drop back through the bottom. Try and keep your trunk vertical the whole time. In this, I'm using my hands through the top and bottom to try and make sure that I'm keeping the right distance between the rib cage and the pelvis. Hands can also go back to feel the seat bones sinking back in them to make sure that you're releasing through the buttock area as you're dropping and then engaging as you're coming forward. Try and draw in across the lower abdomen and pelvic floor as you lift up. This is an opposite arm and leg exercise. It's a lovely exercise for engaging through the trunk or the core, but many people will find this traditional version too difficult or it will aggravate the joints of their pelvis. So instead of doing the opposite arm and leg lift traditionally, we can do modifications such as using a little sliding disc. You can put the disc under one foot, keep some pressure into that foot and keep the leg just sliding directly out and back in. So it tends to place less load through the joints of the pelvis there as you're taking it out and in, but you're still getting some lovely work through the trunk, having to brace through the lower abdominal wall as you're raising the arm and sliding the leg out. Alternatively to a disc, you can use a chi ball, place it underneath the top of the foot, press down gently with the foot into the ball to give that leg more support, and then again slowly sliding the leg and arm out and bringing it back in, taking real care not to let the back sway or drop down towards the floor and trying to not shift the position of the pelvis left to right. Keep your weight right in the midline as you do it. Here we're doing supported squats at the wall. So we've got the ball starting just at the top of the pelvis, and as you squat down, it's rolling in to support the lower section of your back. This way, we're just reducing the load that we're placing through the back and the pelvis as we go. You can go straight up and down. You can do pulses with the legs. You can also add in some raises and lowers through the heels just to increase the challenge a little bit. These are side-on exercises to work more the side buttock muscle. So we've got the ball at the wall and we've got our hips level with that ball, pressing gently into it. The outside leg is about 1 foot width out from the hip, and we're really trying to provide a little bit of compression through the hips, pressing our hips gently into that ball, but just making sure that the knee stays out as you're pulsing up and down on it and doesn't drop in. So this is a closed chain exercise. You can also add a sliding disc to the inside leg and practice moving that leg back and forward as you're holding in a squat on that outside leg. So some really lovely work in and around the hips, trying to look at the control of the movement. You should feel that in the side buttock muscle, particularly on that right-hand side in this clip. Another nice exercise to do at the wall is to stand facing away with 1 foot up and dropping your bottom back towards that heel, and then squeezing through that buttock area and driving through the heel that's on the wall as you're pulling back up into a straight position. Breathing in as you drop and breathing out as you're coming up. Thinking about engaging through the lower abdominal wall as well and lifting through your pelvic floor as you come up. Here we've got our pelvis supported on the ball, leaning forward, taking your baby's weight off your back. And as the stretch is being performed, there's a gentle pressure with the hand against the inside of the thigh, just to provide a light stretch to the inside thigh muscles. Just being careful not to press too strongly into that stretch. So you're sinking down, taking a slow breath in, and then you're releasing that breath as you straighten back up. Dropping down, breathing in, gentle pressure against that leg, Exhale, coming back up. Once again, this is another light stretch for the inside thigh with one leg bent and the other one just extending out. We're just rocking our body weight forward or dropping our trunk forward and letting our tailbone poke out behind us. Just slowly moving into that till you feel a gentle pull on the inside thigh on the leg that's extended. Just go really slowly into the movement. Careful not to take it too strongly. And just make sure that you walk your foot back in rather than drag it. Here we're doing some beautiful pelvic circling, just a lovely way to try and get some release through the hip joints and across the lower back. Just allowing your seat bones to melt down into the ball as you sit, and just that lovely slow rhythmical movement. You can also do a pelvic tilt sitting on the ball, rolling that pelvis underneath you and gently letting your tailbone glide out behind you. You'll notice that we're in a forward lean position, so your baby's weight is off your back when you're doing this one. So these last two are just some really lovely pelvic mobility exercises.